Tests to question after 60. Senior health tips after 60. It's natural to want every test that promises safety and reassurance. But sometimes, more testing doesn't mean better health. It can mean unnecessary worry, false alarms, and treatments we never truly needed. In this stage of life, wisdom becomes our strongest medicine. Understanding which medical tests still serve us, and which ones quietly do more harm than good, is one of the most powerful gifts we can give ourselves. So tonight, let's talk about 5 common tests that deserve a second look, not to create fear, but to bring peace, clarity, and control back into your hands. If you find this kind of honest, caring health talk helpful, take a moment to subscribe. It helps this community of wise, healthy seniors keep growing. Leave a comment sharing your thoughts or questions. I read them all, and give this video a like so it reaches others who need it too. Routine annual chest X-rays often unnecessary. For many years, it was common practice for older adults to get a chest X-ray every year, almost like renewing a driver's license. The logic seemed sound: catch lung problems early, and you might save a life. But medicine has changed, and so has our understanding of what these images really show, and what they often don't. A chest X-ray can be a helpful tool when you have symptoms like a persistent cough, chest pain, or unexplained shortness of breath. It allows doctors to look at your lungs, heart, and chest cavity to see if something looks abnormal. But if you are feeling well, breathing normally, and have no troubling signs, those routine X-rays may be giving you more radiation and anxiety than true benefit. In fact, large medical studies have shown that annual chest X-rays in healthy, non-smoking adults over 60 don't significantly reduce deaths from lung cancer or other lung conditions. That might sound surprising, but it makes sense when you understand how these scans work. X-rays show structure, not small or hidden disease. Many early lung issues simply don't appear clearly enough on an X-ray to be detected. And when something does look suspicious, it's often something harmless, like a scar, a shadow, or even a rib crossing another rib. But once that image raises a question, the next steps can snowball quickly. A shadow might lead to a CT scan. The CT might lead to a biopsy. The biopsy could lead to complications, anxiety, or even unnecessary surgery, only to reveal that nothing was ever truly wrong. For older adults, this cascade can be emotionally draining and physically risky. Radiation exposure is another piece of the puzzle. One chest X-ray is small in dose, but over years of repetition, it adds up. Our bodies become more sensitive to radiation's effects as we age, and while the risk remains low, it's not zero. There's simply no reason to take it when no benefit is expected. That said, there are times when a chest X-ray is the right thing to do. If you smoke or have a history of heavy smoking, your doctor might discuss a low-dose CT scan, a different kind of imaging that's more effective at detecting early lung cancer. If you've had tuberculosis, chronic bronchitis, or repeated pneumonia, imaging may help guide care. The difference is that these tests are done for a reason, not just because another year has passed. Here's what often gets lost in the routine of medicine: tests are not neutral. They have power. They can bring clarity or confusion, comfort or stress. The goal, especially after 60, is to choose tests that add meaning to your health journey, not ones that simply fill a checklist. If your doctor still orders an annual chest X-ray out of habit, it's perfectly okay to ask a gentle question: "Doctor, is there a specific reason I need this test this year?" A good doctor will appreciate your thoughtfulness. Sometimes, that one question helps them re-examine their own routines too. Health isn't about collecting more test results, it's about understanding what truly supports your well-being. For most seniors, that means focusing on things that change outcomes: staying active, breathing fresh air, eating clean, sleeping deeply, and staying socially connected. Those habits strengthen the lungs and the heart far more reliably than an unnecessary annual image. When you look at it this way, skipping that yearly chest X-ray isn't neglect, it's wisdom. It's trusting that your body, when cared for gently, doesn't need to be constantly checked under a microscope. It's understanding that medicine should serve you, not the other way around. So the next time you see that order slip for a routine chest X-ray, take a pause. Ask yourself, am I having any symptoms? Is this test for peace of mind, or is it truly needed? Your answer might surprise you and empower you. Aging gracefully isn't just about adding years to life. It's about adding clarity to those years, about knowing when to say yes to a test, and when to say, kindly and confidently, no, thank you. Prostate-specific antigen, PSA, test question its benefits for men over 60. The idea of catching prostate cancer early feels reassuring. We've all heard the stories, a simple blood test, a quick result, and the comfort of knowing everything's fine. But the truth is, the PSA test isn't always as straightforward or as helpful as it sounds. The PSA, or prostate-specific antigen test, measures a protein made by the prostate gland. High levels can be a sign of cancer, but they can also rise for many other reasons: an infection, mild inflammation, even recent physical activity, or an enlarged prostate, which is extremely common as men age. So while the number may go up, it doesn't necessarily mean cancer is present. This is where problems begin. A slightly elevated PSA can send a man down a long, stressful road of repeat tests, biopsies, and sometimes treatments that cause more harm than good. Some men go through surgery or radiation for cancers so slow-growing they might never have caused any symptoms in their lifetime. What started as a simple precaution can turn into a journey of side effects, urinary problems, fatigue, loss of intimacy, that deeply affect quality of life. It's a difficult truth. After a certain age, many prostate cancers are silent. They grow so slowly that they pose no real danger. In older men, especially those with other health concerns, treating them aggressively doesn't always improve survival, it just adds burden. The goal isn't to find every cancer, it's to find the ones that matter. This doesn't mean the PSA test is bad, it means it should be used wisely. If you are healthy, in your 70s or 80s, and not having urinary symptoms, the PSA test may not offer much value. But if you have a family history of aggressive prostate cancer or sudden changes in urinary habits, your doctor might still recommend it. Context is everything. Unfortunately, many men take the test simply because it's routine or offered automatically at checkups. And when the results come back borderline, anxiety takes over. They start worrying day and night, not realizing that PSA numbers naturally rise with age. The test was meant to bring peace of mind, yet often it does the opposite. This is where having a calm, open conversation with your doctor makes all the difference. Ask, if my PSA is slightly high, what would we do next, or would this test change how you manage my care? These questions help you understand whether the result would actually guide a decision, or just create worry. A good physician won't rush you. They'll explain your options, talk about watchful waiting or repeat testing, and help you decide based on your individual health and life goals. For example, many men in their 70s choose active surveillance, meaning they monitor the prostate carefully over time without rushing into procedures. This approach avoids unnecessary treatments while keeping a close eye on any real changes. What matters most is balance. The PSA test can save lives in certain situations, but it can also lead to overdiagnosis when used too broadly. Understanding that fine line is what makes you an informed patient, not a fearful one. If you decide to skip or delay a PSA test, you are not being careless, you are being thoughtful. You are choosing to protect your peace, your comfort, and your independence. Health, after all, isn't just about avoiding disease, it's about living fully and joyfully without unnecessary interventions. So if your doctor offers a PSA test out of habit, it's perfectly okay to ask, would this test help me, personally, or is it just something we've always done? That gentle question can save you worry, time, and sometimes a chain of needless procedures. Aging with wisdom means knowing that every test should serve your life, not define it. And the PSA test, while valuable for some, is one that deserves careful thought, not automatic acceptance. Your goal isn't to chase every number, it's to stay well, stay informed, and stay at peace with your choices. In the end, true health isn't found in a lab result. It's found in how you feel, how you live, and how confidently you make the decisions that shape your later years. Bone density scans useful, but not every year as we grow older, bones become one of our greatest concerns. They creak, ache, and sometimes break with little warning. It's no wonder many people over 60 are urged to get bone density scans again and again. The intention is good, to prevent fractures and spot osteoporosis early, but repeating the test too often can do more harm than good. A bone density scan, often called a DXA scan, measures how strong your bones are by comparing your bone mass to that of a healthy young adult. The result is a number, known as a T-score, that tells your doctor whether your bones are normal, slightly weakened, or in the range of osteoporosis. It's an excellent tool for understanding risk, but it's not meant to be done every year. Here's why. Bones change slowly. They don't grow weaker or stronger overnight. For most people, repeating a scan sooner than every 2 to 5 years rarely shows any meaningful difference. Yet many seniors are sent for annual scans out of habit, even when their last results were stable. This can lead to unnecessary worry over small, harmless variations that come from machine differences or normal fluctuations in body chemistry. The truth is, the most important step in bone health isn't the frequency of testing, it's what you do in between those tests. A scan alone won't protect your bones. What matters is how you live. Regular walking, light weight-bearing exercises, and spending time in sunlight help maintain bone density naturally. Getting enough calcium and vitamin D through food, like leafy greens, fish, or fortified milk, supports your body's quiet repair process every day. Overtesting can also have unintended consequences. When a bone scan shows even a mild decline, some doctors rush to prescribe strong medications right away. These drugs, while sometimes useful, can come with side effects like jaw problems, stomach irritation, or rare bone fractures if used too long. For many seniors, the risks outweigh the benefit, especially when lifestyle changes could make a big difference without the same strain on the body. Another issue with frequent scanning is psychological. Seeing numbers drop, even slightly, can cause anxiety and fear, emotions that often lead to unnecessary treatments. People begin to see themselves as fragile when, in reality, they might still have strong, resilient bones for their age. Numbers are not the full story, function and stability matter just as much. Here's a balanced way to think about it. If you've never had a bone density scan and you are over 65, or 60 if you have risk factors like early menopause, long-term steroid use, or a family history of fractures, it's wise to get one baseline test. This helps you and your doctor understand where you stand. But once you know your baseline, the timing of future scans should depend on your situation, not the calendar. If your first test was normal, repeating it every 5 to 10 years might be enough. If your bones were moderately thin, a 3 to 5 year gap could be reasonable. Only those with rapid bone loss, certain medical conditions, or on specific medications may need closer follow-up. It's also important to remember that bone density is just one piece of the puzzle. Balance, muscle strength, and coordination play just as big a role in preventing fractures. A strong back and steady legs protect you better than a perfect T-score on paper. In other words, fall prevention is just as important as bone preservation. So, before agreeing to another yearly scan, ask your doctor a simple question: has anything changed that would make this test necessary now? If the answer is no, it's perfectly safe to wait. Use that time to focus on the daily habits that truly build bone resilience: walking outdoors, eating well, maintaining a healthy weight, and keeping your muscles active. Health is about rhythm, not repetition. Just as your heartbeat doesn't need constant monitoring to prove it's strong, your bones don't need yearly scans to stay healthy. Give your body credit, it knows how to repair and adapt when given the right care. Aging wisely means learning to trust that process. Fewer tests don't mean less care. They mean better, more meaningful care, the kind that respects your time, your comfort, and your body's natural pace. And that's the best kind of medicine there is. Colonoscopy after 75. It's time to rethink. For decades, colonoscopies have been considered one of the cornerstones of preventive medicine. They've saved countless lives by catching colon cancer early, often before it starts. For people in their 50s and 60s, the procedure makes good sense. It can detect and remove precancerous growths long before they turn dangerous. But after 75, the balance between benefit and risk begins to shift. A colonoscopy involves inserting a thin tube with a camera through the colon to look for polyps or abnormalities. It's an important test, but it isn't without its challenges. Preparing for it can be physically demanding, fasting, drinking large amounts of bowel prep solution, and dealing with dehydration and fatigue. For younger adults, this is unpleasant but tolerable. For older adults, especially those with other medical conditions, it can be quite stressful. Then comes the procedure itself. While it's generally safe, it does carry risks. Sedation can cause confusion or low blood pressure. The scope can occasionally lead to bleeding or even a small tear in the intestine. The odds of these complications rise with age, particularly in those over 75. At the same time, the potential benefit decreases. Colon cancers often take many years to develop. That means if your previous colonoscopies have been clear, and you are in your late 70s or 80s, the chance that a new, aggressive cancer will appear and progress during your remaining lifetime becomes quite small. In such cases, another colonoscopy may offer little advantage but still expose you to unnecessary stress and risk. This is why many medical organizations, including the U.S. Preventive Services Task Force, now recommend individualizing the decision after age 75. That means instead of automatically scheduling another test, you and your doctor discuss your specific health, history, and goals. If you've had several clean colonoscopies and no family history of colon cancer, it may be perfectly safe to stop. If you've had polyps before or a strong family history, your doctor might suggest one final screening, but even then, it's important to consider your overall health. There's another layer to this conversation that isn't talked about enough: dignity. Many older adults undergo repeated medical procedures simply because it's what's expected. No one stops to ask whether the discomfort and anxiety are truly worth the small possibility of finding something new. After 75, medicine should shift from searching for problems to preserving comfort and function. That doesn't mean ignoring your colon health. There are gentler ways to monitor for warning signs. For example, stool-based tests, like FIT or Cologuard, can detect hidden blood or abnormal DNA without requiring a scope. These tests are much easier on the body and, for many seniors, are a safer way to stay informed. Lifestyle choices also play a huge role in keeping your colon healthy. A diet rich in fiber, vegetables, and whole grains supports regular digestion and lowers cancer risk naturally. Staying hydrated, limiting red meat and processed foods, and keeping active all support colon health far more consistently than any single screening. The key is perspective. At 60 or 65, colonoscopy is an act of prevention. At 75 and beyond, it can become an act of habit, something done automatically rather than thoughtfully. And at this stage of life, thoughtfulness matters most. Every medical decision should align with your values, peace, independence, comfort, and quality of life. If your doctor suggests another colonoscopy, it's okay to ask, would this test change anything about my care? That question opens an honest discussion about your risks, your previous results, and whether the procedure is truly necessary. A caring physician will appreciate your curiosity. It shows that you are taking an active role in your own well-being. Saying no to another colonoscopy after 75 isn't giving up on your health, it's acknowledging that your health goals have evolved. You are not fighting for more years at any cost. You are protecting the years you have left with gentleness and purpose. Aging wisely means knowing when to keep looking for disease, and when to start simply living free from medical rituals that no longer serve you. It's about shifting focus from fear of what might happen to appreciation for what's happening now. So, before you agree to another colonoscopy, pause for a moment. Think about your past results, your current health, and how you want your time and energy spent. The best medicine, especially in later life, is the kind that respects not just your body, but your peace of mind. Thyroid blood tests, commonly misused and overinterpreted among all the blood tests doctors order for seniors, the thyroid test might be one of the most misunderstood. It's quick, inexpensive, and easy to perform, which is why it's often added to routine checkups without much discussion. But for people over 60, thyroid levels can naturally shift with age, and that can lead to unnecessary worry, misdiagnosis, and even lifelong medication for a problem that doesn't truly exist. The thyroid is a small, butterfly-shaped gland at the base of your neck. It produces hormones that regulate metabolism, energy, and mood. When these hormone levels drop, it can cause symptoms like fatigue, weight gain, or feeling cold. When they rise, you might feel anxious or restless. It sounds simple enough: measure the hormones, adjust with medicine if needed, but the reality for older adults is far more complicated. As the body ages, the thyroid tends to slow down a little. This mild decrease is often a normal part of aging, not a disease. Many seniors feel fine, yet a routine blood test shows a borderline low result. Without symptoms, some doctors still prescribe thyroid medication out of caution. The patient begins taking daily pills, returning for repeated blood draws and dosage changes, all for a condition that might never have caused trouble in the first place. The result? The body's natural balance gets disturbed. Taking thyroid medication unnecessarily can speed up the heart, cause anxiety, weaken bones, and even increase the risk of irregular heart rhythms. In older adults, these side effects can be far more dangerous than the mild thyroid shift itself. What's even trickier is that many symptoms blamed on thyroid issues, like tiredness, weight changes, or memory lapses, are also just part of normal aging or other common conditions. When doctors treat every mild thyroid fluctuation as a problem, they risk missing the bigger picture. Lifestyle, diet, sleep, and medication interactions all play a role too. That's why leading endocrinologists now recommend a more cautious, individualized approach. If your thyroid-stimulating hormone, TSH, level is only slightly outside the normal range and you don't have strong symptoms, it's often best to wait, retest in a few months, and monitor how you feel. Many seniors' numbers return to normal without treatment. If your levels are truly low and you do have symptoms, extreme fatigue, constipation, dry skin, or feeling unusually cold, then medication can help. But the goal should be to use the lowest effective dose, monitor carefully, and never adjust medication based on numbers alone. How you feel matters more than the exact figure on a lab report. Another common pitfall is overtesting. Some older adults have their thyroid checked multiple times a year without any new symptoms. That's rarely helpful. The thyroid doesn't change that quickly, and frequent testing only adds confusion and cost. Unless you are starting or changing medication, once-a-year testing is usually enough. If you've been told your thyroid numbers are a bit off, take a breath. Ask your doctor questions like, could this be normal for my age? Do I actually need medication right now, or should we recheck later? What symptoms should I look for before deciding? These small questions open big conversations and protect you from unnecessary treatments that might make you feel worse instead of better. The thyroid story teaches an important lesson for all seniors: not every irregular number means illness. Sometimes, the best care is to observe rather than intervene. Medicine works best when it's based on how you feel, not just what a computer screen says. If you are already taking thyroid medication and feeling unsteady, talk with your doctor about re-evaluating your dose. Never stop on your own, but know that adjustments can often improve how you feel day to day. At this stage of life, your goal isn't to chase perfect lab results, it's to find steady balance. The body naturally adapts, slows, and changes over time. The thyroid follows that rhythm too. The key is knowing when those changes are normal and when they truly need help. So, the next time you see a thyroid test listed on your checkup form, don't hesitate to ask why it's being done. The best healthcare comes from curiosity, not compliance. You have every right to understand what's being tested, what it means, and how it affects your daily life. Aging wisely isn't about rejecting medical care, it's about refining it. It's about trusting that your body, even with its quiet shifts and slower pace, is still capable of remarkable balance. And sometimes, the healthiest choice is not to treat, but simply to trust time, observation, and gentle living. When medicine becomes a partnership instead of a routine, it gives you back what truly matters: peace of mind, confidence, and the freedom to enjoy the years ahead with clarity and grace.